Hey guys, it's Dr. Myson, and welcome to Module 5. So this is actually our second to last module. We're almost done. We just have to get through these next few modules and we'll be ready to move on. Module 5 covers neuro and psych, which are very important topics. We see a ton of neuro stuff and psych stuff in primary care. So there's a lot of information here to cover over these next couple of weeks, but hopefully giving you a little breakdown of what to focus on will help you get through it. Okay, so let's take a look at Module 5. The topics we're going to cover for the neurological system. And I broke this up by drugs and conditions. So for all of the drugs that are listed here, you are going to want to know the indications for that class of medication, how that drug works or the mechanism of action, the onset of therapeutic effect. How long should it be before we start to see a therapeutic effect or improvement in symptoms? Significant adverse effects. And again, I don't want you to be able to list every single adverse effect that's possible with this medication. I want you to know the significant adverse effects and how those can be treated. So just for instance, SSRIs can sometimes cause sexual dysfunction, which can improve with the addition of bupropion. So that would be something that I would want you to know. And if it's significant or important, it will be discussed in the lecture. I also want you to know significant contraindications. Who should you not prescribe those medications to? And then how do you know the drug is working? How long should you give before you follow up with the patient? So those are the key things that you want to know for each of these medication classes. And the classes that we're going to discuss in the neurological section include the cholinesterase inhibitors, for instance, donepezil, the triptans, which you'll see all end in tryptan, the ergotamines, and then butalbital, acetaminophen, caffeine. That's Fioricet. We also are going to talk about the anti-epileptics, including topiramate, phenytoin, gabapentin, and carbamazepine. The beta blockers, which you'll see all end in LOL. And we talked a little bit about beta blockers in the cardiac section. These are beta blockers used specifically for neuro conditions. Really, we're just talking about how we use beta blockers in the preventative therapy of migraines. So again, that's what we're focusing on for this module. We're also going to discuss the neuroleptics, compazine and promethazine, dopaminergics, including carbidopa, levodopa, pramipexole, and ropinirole, and then the NMDA antagonist memantine, the CNS stimulants, methylphenidate, and the opioids. So those are all the classes of drugs we're going to cover in Module 5 for the neurological portion. The conditions that we're going to cover, and for the conditions listed, you're going to want to know what first-line therapy for that condition is, patient education. So what does the patient need to know about that medication that you're prescribing for him or her? What should be monitored as far as blood work, any other testing that needs to be done, and when should you follow up with the patient? And then also, when you follow up, what do you do if it's not working? So what's the second line therapy for those conditions? So we're going to be discussing migraine headache, tension headache, Alzheimer's disease, and Parkinson's. Those are the neurological conditions that we're going to focus on in this module. Next up, we have the psych portion of the module, and again, you're looking at the indications for these drugs, mechanism of action, onset, adverse effects, contraindications, and evaluation and follow-up. For the psych drugs, we're going to be talking about the SSRIs, the SNRIs, benzodiazepines, the tricyclic antidepressants, and the antipsychotics. For all of the conditions listed, we're going to want to know the first-line therapy, again, patient education. What does the patient need to know about the medication that you're prescribing, monitoring, and follow-up. So anxiety and depression are the big conditions that we're going to be focusing on in this module. The book chapters are listed here. Again, I say these are book chapters for your review. I don't expect you to read every sentence of every chapter. Kind of use the book to supplement the information that's in the Moodle module. I also just want to point out that there is a supplemental video here as well, so make sure you watch the video on the management of dementia. The CDC guidelines for prescribing opioids for chronic pain, these were new in 2016. These are very important for you to look at as well. And then the Module 5 questions forum is here. So if you have any questions about any of the content in Module 5, make sure you ask in that forum. You can also email me. If you're really struggling with something and you want to meet on campus, we can definitely set something up as far as a meeting, a face-to-face meeting goes, or we can do a WebEx, whatever works for you. So just remember that I'm always here if you have any questions.